Well, let's get into what the device monitors and why that's completely different from anything else on the market.
We are the first ever FDA cleared medical watch in the world that does blood pressure using oximeter cuff with the micropump built in, with the accuracy better and equal to the Omrons and the others of the world on the arm cuff using radial artery, plus 10 other vitals on top of it, which even the fitness does cover and more.
Mhm.
We do oxygen, heart rate variability, sleep, steps, sedentary, reminders of their appointments, medication adherence, missed medication, what happens to your vitals, deep sleep, blood pressure. It's unbelievable. And on top, I go back to my original same question. And the question was, would you give this to your parents that they can be anywhere in the world, like my parents, and I can see their data real time, have a peace of mind sitting here, and I can even remote trigger a blood pressure. That's our patent.
This is the Walter Bacon podcast, where I highlight some of the most practical and game-changing tech startups. Today, I'm with my friend Gaurav Kohli, CEO and founder of VitalFriend. VitalFriend is the first ever FDA-cleared medical watch in the world and does something no other wearable on the market does today. It brings together clinical-grade medical data, real-time fitness monitoring, and a medication adherence in a single device. Not a fitness tracker, not a hospital monitor, something entirely new. So, Gaurav, it's great to have you today.
Same here. Thank you, Walter, for having me here.
Well, let's get into what the device monitors and why that's completely different from anything else on the market.
So most of the devices that are in the market, Walter, they are fitness trackers. We can name so many, and this in abundant back in China too. So I ask a simple question to you and to the audience, right? Would you give that device to your parents and you would like to know how their health is today? And will you trust it and give it to the real doctors and nurses and saying, that's what's happening with my family? It's a
Not a
very
fitness, not a fitness tracker, right?
a
No.
fitness tracker. That's where I saw everybody has phone systems convert to watches, or you have basically fitness center, but nobody was attacking the diagnosable data realm. That's where I said this was done. We
Mhm.
are the first ever FDA cleared medical watch in the world that does blood pressure using oximeter cuff with the micropump built in, with the accuracy better and equal to the Omrons and the others of the world on the arm cuff using radial artery, plus other 10 other vitals on top of it, which even the fitness does cover and more. We
Mhm.
do oxygen, heart rate variability, sleep, steps, sedentary, reminders of their appointments, medication adherence, missed medication, what happens to your vitals, deep sleep, blood pressure. It's unbelievable. And
Mhm.
on top, I go back to my original same question. And the question was, would you give this to your parents that they can be anywhere in the world, like my parents, and I can see their data real time, have a peace of mind sitting here, and I can even remote trigger a blood pressure. That's our patent.
Nice, nice.
Nobody can do that. Anyway,
Awesome. So let's get into the benefits to the patient and family. So you mentioned the remote monitoring of your family members. So the benefits to the patient, there's so many.
so the patient basically wants, in today's world, a peace of mind in terms of looking at the data. All the data I have done so many studies. I've written so many articles on wearing so many variables. I can name them on and off, and it's all data. You're looking at it, seeing your steps, seeing your sleep, seeing your blood pressure or anything right that you do, or knowing about your heart rate variability. Please ask a common man, do they understand? A common person, do they understand? Right? A man or woman, they don't get it. Right? It is just a line in the bar chart. That's where I see what we provide. We provide basically a device that's medically graded, data that is diagnosable. People can rely on that data really fully end to end with how many lives we have saved over time. I can go on many other things. And then on top of it, summary and recommendation how to make it better. Your heart rate is X, your blood pressure is high. Okay, what do I do now? You help them to make it better. So our AI engine takes all the data, brings it back into the our database. We collect 8.64 million data points per day per watch.
Wow.
Nobody collects that, right? When we collect that data, our real doctors and nurses on top of it look at that data, monitors the data, and provides recommendations to the patient to make their life better. They can track it, they can look at standard deviation, they can see how close they are to the goal, not close to the goal. Now you're actually making an impact to their lives. And to your next follow up, I know you're going to easily ask, what happens to the families on that? That's where the best part is. Patient is happy, Family also have access to the same data because the first time ever, the data is owned by the patient, not the medical health systems, not the doctors, not anybody. It's the patient. Patient is requesting RPM, which is remote patient monitoring.
Mhm.
Patient can give consent to whoever wants to see the data. So now patient gives a consent to the family members. Family members give peace of mind, but they don't want data overload. They don't want to see my mom and dad is following the goals properly. No, what they want to know, thumbs up, thumbs down. Do I care?
Mhm.
Do I don't? So we've been very great in terms of building products in people's lifestyle, a lifestyle of a family, a lifestyle of a patient, and how do you help each other? Looking at the same data view with different type of summaries, affecting the patient's health and better outcomes. Imagine
So,
that use case.
so thinking about like a facility where you have a bunch of patients. So instead of making the rounds, I heard you say it totally eases the burden on making rounds to everybody's room.
So let me just finish one thought on the doctor. So doctor basically gets value because the patients are taken care of better for better outcomes, because that's the true value of what the doctor wants to look at, right? Is things improving? Why are you going to a doctor once a month or once a year with one reading? Now you get multi readings. So that's the key.
Mhm.
Going back to the facilities, absolutely no brainer. The facilities today, the caretakers, they spend their rounds on round one, round two, round three, patient one, patient two, patient three, patient four. Again, okay, vitals, medication. Okay, they have no idea who's on panic alert, who's not, because these are not hospitals.
Yeah.
These are assisted living associations or skilled nursing facility. So now you have a dashboard on a TV that shows there with our Vital Friends dashboard. We call it the Vital board. They see the vitals board and it automatically alerts what is happening because all the vitals are already taken. We already know. I'll ask you a simple question, Walter. We all do this all the time. We say 10,000 steps is a great thing to do every single day. Okay, you get up in the morning, go to your gym, do your 10,000 steps. Sit down in front of the TV or you're working 24/7, and now you're just working. Your back is going to hurt. You're going to be in a chronic condition. I guarantee you're going to be qualified for a free buddy because of this the whole reimbursement. So we gotta make sure things are managed, calories are managed, over the day mobility is managed. So we do so much in our algorithms to know how much have you done. You've been walking and exercising, now you take your blood pressure. It's not right. In the care facilities, what they do is they take the patients every day in the morning a walk. Every afternoon they have a care plans created, right? They have changed their care plans because of Buddy. Because now they've said, wait, Kohli gets up in the morning at 10 and his blood pressure is always high. Why are we taking him for a walk? Let him relax a little, right? Let him stabilize. Then we take him for a walk. So they've changed these personalized care plans. The world is changing to personalized vitals. We are
Yes.
attacking that head on, is personalized vitals.
Awesome. You mentioned insurance. So there's also a benefit to the insurance providers, right?
Right. So insurance providers, you and I know we all can say this thing any day, right? Medicare and all the other big providers, CMS and insurance companies, they're all depleting money. When people start going, if let's say when COVID happened, we heard all the stories. Everybody went to a doctor, right? Who's paying for it? Somebody's paying for it. It's not free, right? Imagine some other things happen where the pandemic or non-pandemic happens, right? People would go to doctor all the time. How can you prolong that if it's needed or not needed to go, right? How do you do preventative better? I am 48. I'm collecting my data with a buddy. I go 58. I will have 10 years multiplied by per day, 365 multiplied by 8.64 million data points, equal to my summaries, equal to the AI engine can process it for a single human being in 10 years. And now I multiply that by when I'm 75. I'll be able to tell the doctor exactly, hey, doc, this is the thing. He can go back in time and take a look at it when it started and what precautions did I do and why it did not improve. That data and that summary is what we are into, making the life easy for the doctor, life easy for the insurance company, because now insurance company can be more preventative. When you put an automatic or you put a OBD connector on your car and you're tracking all your data to know how your car is working, is to prolong the life of your car. Same thing, we are humans, we're mobile, we're like a car. So
Hmm.
why not apply that same logic and give them a buddy?
Hmm. So thinking about the doctors, practices, facilities, assisted living, like what is the big benefit to them as well?
The doctors, their life is much easier because now imagine a person on a travel to Colombia gets stuck in and cannot travel back. Suddenly they cannot get clearance to get on a cruise ship or a plane because of their heart palpitations or others, right? Imagine they're wearing a buddy. They ping the buddy through the buddy. Buddy can actually take a phone call, by the way, just to let you know. It's pretty cool. So they use the buddy, automatically our system gets alerted. Doctors gets alerted. Doctor gets on a televisit. They say, "Hey, Mr. Kohli, I know you're stranded there. How can I help you? I saw there was enough variabilities happening and stuff like that. Let me take a look at it. You know what? You're all good. Let me take all your vitals. I can sit down, put your hand here, and the doctor can press and take all the vitals real time, including blood pressure. Nobody has achieved that.
And the oxygen, exactly what
And
they do when they
oxygen,
put you in the room.
oxygen, temperature, blood pressure. Three
Yep.
things, right? And more. And more in terms of, did you have a better sleep? Hey, Gaurav, were you Mr. Kohli? Were you partying yesterday in a cruise ship in Colombia? And that's why you did not get your blood pressure was high. So then let me give you a clearance note right now. Here you go. You have it all on your here. You can even show it from the watch itself and saying, this is what the messaging is. This is what my doctor cleared.
Hmm.
Done. People love us because of our backend platform. You're going to love this, Walter. This is just point one. We integrate with 350 devices in our platform today, including all the other variables. We collect all the data. So we even tell people that, if you don't want a buddy and you want to use your own platform to collect it, sure. The only problem is that you're not going to get 8.64 million data points and,
Right.
and other things, but you will get all the other analytics we are building right behind the scenes.
Hmm.
So there's a huge value on the platform that comes in for managing better care to the patients.
Cool. So how do we get one?
So, if you need one, there are two ways to get. We have two models. We have a reimbursement model through Medicare and others, and we have a chronic condition in which you need to have a chronic condition and you need to qualify. Uh, so that's one model, which is reimbursement model. So if you reach out to us, we can take a look at it, see if you qualify because of chronic condition, and now it's reimbursed fully. So no cost to you at all, both for the device and for the monitoring service. The second model we have is a cash pay model. I call it the longevity cash pay model because now many longevity clinics are using us. In that model, you get the device for $150 from our site or from reaching out to us, and then you pay a subscription of $30 per month for data as you use the data. So it's not a monthly subscription you have to pay every single day. We are working on a model where you can pay when you use the data.
Like when you want to report, like you
When you want to
yeah.
report, you got it exactly right.
Okay.
I want to report. I want to send it to my doctor. Okay,
Amazing.
and in that case, you're not. It's not a Netflix model, right? So you don't have to basically worry through it. But a lot of people want to use it monthly, then go for it. So we don't charge you max than $30.
Hmm.
Basically, is what our goal. Our goal is to save a life and help people, not charge. And we have discounts and promotions going on all the time to reduce both sides.
Hmm.
And we have a referral model. If each person refers 5 people and they become it, then you have a whole year free.
Hmm.
So
Amazing.
there are many ways because the goal is a viral effect.
Well, talking about the benefits to investors, so I did read that there's an increased market of seniors. So if you want to touch on why the market and the demand for this is going to skyrocket, can you get into that a bit?
Yes. The data stats are very clear right now. We have 12,000 people becoming Medicare compliant or Medicare applicable or seniors, which we call them, right? At every day. Every day. It's a number that is unbelievable. And they're predicting to have 72 million people, basically seniors, by the 2030. Okay, and that is huge. In that, if you look at facilities, maximum total beds in the facilities in the whole America is no more than 7 million. And you got 72. That means you got over 65 million people who are going to be aging at place,
Hmm.
right? That means they need help. That means they need care. They need somebody to be taken care of. Older they grow, more care is required, right? And because of technology, because of medication, because of advancements in pharma, people are living longer. So we had a 104-year-old wearing this today, right? And we have a 10-year-old wearing this today also, right? This is how cool it is when we're collecting the data and we're learning. So my question comes down to when you have that care provided, you need something you can trust on, you can believe on, and the data that comes out of it is diagnosable.
Hmm.
So that's why the investors are going into it in many areas, from home health care, from providing the right value, the right different type of data analytics, AI. The investors are very interested in that space.
Hmm. Cool. Well, Gaurav, I can't wait to get mine. So it was, yeah, yeah.
Sorry.
So it was great to have you today and learn more about VitalFriend and VitalBuddy. So really look forward to getting my watch and watching the data and learning more and just continue to watch the company explode and grow.
Thank you so much, Walter. And for you, definitely, this has been a great time for us also. And if you need yours, same thing, reach out, we can talk.
Okay.
And happy to have you one that you can actually show it to your users.
I will.